Hello everyone. If you're looking for a good dentist who has built a solid reputation on comprehensive dental care, you're not going to want to go away. Stick with us. We'll be right back. We're going to talk with Dr. Edwin E. Welcome back. I'm Malia Allen, and dentistry is more than just a technical treatment. It is an art form, and Dr. Edwin E is here with me today to talk about that because, Dr. E, that's kind of the basic tenet of your and your philosophy behind your dental practice is that you have more of an art form with your dentistry. Tell me about that.
Dentistry as an art, it started when I was a young boy, and I loved to work with my hands, building model airplanes, model cars, model ships, and I've always enjoyed that. And so you develop an eye for detail as you do those things. And I used to do a little drawing, and those things always appealed to me. You know, in nature and also in mathematics, there is a principle called the golden proportion. And what that talks about are the ratios of how things relate. Its symmetry, its balance, its shape. With our great artists Leonardo da Vinci and with Michelangelo, they used those same principles as they were doing their masterpiece sculptures and paintings. And in dentistry, we tend to look at some of those same principles of balance and proportion, and when we're trying to create a pleasing aesthetic smile. And a
beautiful smile. And I'm certain that those proportions also play toward the function of the teeth as well.
Yes, things have to fit together, because if they don't fit together, things are going to wear improperly, things are going to wear out sooner than they should, things are going to crack or break, and I think we've all seen people where their teeth don't fit together, they're not balanced, and you can just look at their smile and it's really worn down.
Just not right. Dr. Yee, you have some basic tenets in your philosophy. Tell the audience what your thoughts are with regard to general dentistry and what your overall perspective is in providing dentistry to your patients.
Well, I believe that there are three important parts in good dental health. First of all, it's the overall health of the patient, their overall function of how well their teeth fit together and work, and then that leads to the aesthetics and the beauty and the pleasing smile and an attractive smile. And so those all go together.
So I would guess that it's really important to find a dentist who focuses on all three of those components, not just one of those three. Some folks are real good at just the technical expertise of dentistry. They can do fillings and they can do crowns and they can just do those things. Some folks are really good with the aesthetics, and some people are good at all three. And that's one thing that I think that you bring to the table. You certainly are kind of a health nut yourself. You're into physical fitness. And you know, I'm one of your patients. And when I came in, it was real important for you to kind of know what activities I was involved in and what kind of sports I did. That's real important for you in educating your patients and knowing all about them so that you know how to prepare a treatment plan for them.
When a patient comes in to see us, we do take the time to get to know them and find out what's important to them. And you know, that all comes back to the comprehensive approach that we take, because we really want to know what's going on with you as a person.
Right.
And the comprehensive approach, you know, we look at all of those things that we talked about: the health of the mouth and the teeth, the functionality of the teeth, how well they work together, and the beauty of the teeth. And that all falls under that umbrella of comprehensive dentistry. We get to know you, understand what's important to you, and we tailor our treatment approach to your needs.
Right. Now, folks, comprehensive dentistry doesn't just happen. You have to schedule appointments, and you really have to have a relationship with your dentist. So it's real important for you to make those appointments and come in regularly, because that's going to help you in the long haul. There are two main reasons that you mentioned to me that keep folks from the dental chair, and what are those reasons?
Well, it seems to be that fear and cost are the two main things that prevent people from going to the dentist. and maybe even procrastination could be a third one.
Right. Or stress in life, or they have events that happen, like with me when I first came to see you. Let's talk about very briefly fear. You specialize in kind of a relaxation dentistry, and what does that entail?
People that are anxious when they come to see us, there are several things that we can offer to help relieve that anxiety. The first most important thing is just talking to them and finding out what is creating the fear for them. In some people it's the injection, some people it's the noise of the procedure, some people it's just being in a dental office. And so once we identify what the areas of concern are, for some people just by gentle treatment and just
relaxing music
and lots of TLC, we can tender loving care, we can help patients get through that. But in other patients, we might offer a prescription of an anti-anxiety medication.
Sure.
That's a short-acting medication that lasts just for that procedure. And then the other thing we can offer is called nitrous oxide, and it's a gas, it's a mild sedative. They can breathe that, and that creates the same relaxing effect that the pill can do. So
now cost is another one, folks. Now, how many of you have been out there and you go to the hair salon every month? You spend $100 or $200 if you're like most women. You have gym dues, you buy athletic shoes, you do all of those things to take care of your overall health, but sometimes you can neglect the very basic things. And the thing that most people see the very first when they meet you is your overall smile, and it really does set the tonal quality of your face and how open you are and approachable you are, and your overall beauty. And so I think a lot of folks have that obstacle of just the overall cost, but really a couple of visits a year, not that expensive.
If you're doing preventive care and taking care of yourself, you're exactly right. It's probably less than the cost of what you might spend at the hairdresser, over a whole year. But good dental care is not an inexpensive procedure. Whereas if you wait until something breaks or wait until something hurts, and then you're into this patch and repair type of situation, it can be more expensive over a lifetime rather than doing the right thing at that particular time. Good dental care, it's an investment for a lifetime, and it's an investment in your health, and it has lifetime benefits. It affects your quality of life, it affects your confidence and your smile, and enjoying the simple pleasures of life.
It really does. And we're going to be talking more about some of the procedures you offer, but we'll be right back, so stay with us.
With Dr. Yi, you always get his personal attention all the time. When you walk in the door, you have Edwin's wife greet you by first name. It's almost like you're an extension of their family. You feel very comfortable, you feel very at home, and it kind of puts you at ease. I would rate Dr. Yi as exceptional. When we came to Pensacola 10 years ago, we didn't know where to go. An associate referred us to Dr. Yi. And we've been here ever since, and glad we're here. My son comes here. Our whole family are regular patients for Dr. Yi, and he's a detailed guy. He does everything right pretty much the first time. You don't have to come back for repeat visits to do the same work you did the last time. That kind of professionalism is really appreciated.
And welcome back. I'm talking to Dr. Edwin Yi, who's actually my personal dentist, and we've been talking about, Dr. Yi, your practice and what to look for in a good comprehensive dentist. And that's real important, a dentist who actually is going to address all of the needs of your health. And we talked about earlier how dentistry has three main components, which is overall health of the body, and we talked about the aesthetics and the beauty, and we talked about function. What are some of the treatments now that are available out there that you offer at your office?
Well, in our office, of course, we offer preventive care. We have a hygienist that will help take care of the routine maintenance needs. Certainly we have restorative care, which is basically talking about when a tooth has a cavity and it needs a filling. And we're using tooth-colored fillings today. And then if a tooth has more damage to it, and it's broken and a filling won't be sufficient to repair the tooth, we're doing crowns or onlays and veneers and things of that nature to help rebuild and restore a tooth. And then that also gets into a little bit of the cosmetic dentistry where someone's really looking to do a smile makeover and change the appearance of their smile, and that's where veneers can come into place. And in some situations, you don't necessarily need veneers on every tooth. Cosmetic dentistry is where we talk about making changes, subtle changes to just a few teeth to make it blend in with the natural existing teeth, and it looks like it belongs.
Right.
And so that's the art of cosmetic dentistry.
Well, and you know, you mentioned that because one of the things that you really specialize in is not only the technical component of dentistry, which there is a technical component, but also the artistry. You talked to me before about when you were younger how you like to mold with clays and that sort of thing. Does that translate into what you do now with the cosmetic portion of the dentistry?
Definitely it does, because when you're working with your hands, and whether you're working with clay and building something, or you're building models and airplane cars and boats and things of that nature, it takes a certain hand-to-eye coordination and looking for different textures and how things look and fit together. Exactly.
Right. Now, you and I talked about doing veneers, which is, of course, a more permanent solution to the teeth. I had bonding done because 2 of my teeth were not genetically large enough to occupy the space once I had my braces off, and that's pretty common. You know, my teeth couldn't maintain the right spacing that they needed to stay straight, so we had to make those teeth a little bit bigger. Veneers were not an option when I had that done. So the newer technology then is the veneer. A lot of folks equate a veneer with a lumineer, which is the brand name that a lot of people think about. What are some of the options available, and what do you use as far as product goes in the veneered category?
A lumineer is just a brand name of a product that's a veneer. And basically a veneer is a very thin covering that's made to fit over a tooth, and it can change the color, it can change the shape and outline of a tooth. So just like in cars, we've got Mercedes, BMW, Chevrolet, Ford, they're all cars, but you know, you just got different brand names, and so lumineers is just a brand name of a veneer.
When would a veneer be merited for a patient, I mean, versus a crown?
Good question. When a tooth has been broken, or to a degree where a third or a fourth of the tooth is missing, or the tooth is out of position, it's too small, it's too short, it's too far back, things of that nature, and we want to improve the position of the tooth, that's where a veneer is indicated. If it's just a small area that we're dealing with, sometimes bonding can actually be the best choice for it.
Like a small chip in a tooth where only a fraction of the tooth is involved.
That's correct.
Now, versus a crown, which would be a tooth that really is not very preservable. Is that right?
A crown, we perform that procedure on a tooth that has had significant damage, and we don't have enough tooth structure to work with to repair with a filling or even with a conservative veneer. And so a crown covers the tooth completely to rebuild it, to make it look like a natural tooth, so that it's strong and so that it's functional. Now,
how does that crown differ from the veneer? Now, you have a model here that shows how the veneer is actually attached to the tooth. Can you show us what that looks like, and what is the procedure here?
There are several thoughts out there about how veneers can be done. Sometimes it's promoted that it's applied directly to the teeth without any preparation, any drilling, any injections. Because if you think about it, if you've got a natural tooth and you're making a veneer to go over the front of the tooth, and even though these veneers are thin, and you put that directly over a tooth that has not had any reduction at all, and then you put this on, and it's cemented,
going to get a larger appearance.
It's going to make your teeth feel bigger and thicker and bulkier. So a more ideal situation for most people, there is some minimal preparation that we do to the teeth. It's very conservative. I don't know if you can see on this model where we just take a little bit off the front of the tooth and maybe just a little bit on the edge of the tooth. A veneer is custom crafted and made in the laboratory to fit over the tooth. It's bonded in place, Each one is an individual tooth so that you can floss between them. And these are very strong and durable, and they look very natural.
Dr. Yee, implantology, a lot of folks have heard about individual teeth. I think my mom's had a couple of her teeth that, you know, she had a crown, and when it came time to replace that crown, she opted to do an implant. What is an implant, and can you implant more than one tooth at a time?
A dental implant is basically an artificial root. So when a tooth has to be lost or taken out, we can take an artificial root, and this is placed into the bone and threaded in, if there's enough space.
Into the bone itself.
Into the bone itself. And then we have a portion of it that is above the gum tissue, and this is called a post, and then a crown is made where it's permanently cemented on top of the post. And then this functions like a natural tooth.
Well, and this has got to be the optimal technology now. Now, what if I had several teeth, whereas in the past I might have a bridge? What would be the correction for that? Could I do 2 or 3 teeth in a row?
Actually, you can also do a bridge. If you were missing several teeth,
right,
and you could put an implant here, and you could put one here, and then you could make a bridge that goes from this one to this one.
So it's more permanent in structure.
Absolutely. And so these are like natural teeth, where they're comfortable, they're strong, they're stable, and you don't have to worry about things moving around inside the mouth.
Exactly. Now, you mentioned this to me earlier, and this is what you call teeth in a day. This has really taken dentures to a whole new level. What is teeth in a day?
In this procedure, someone that has unfortunately neglected their mouth to the point where we can't save enough teeth to be able to rebuild with crowns or bridges or partials, and their only option is to lose their teeth. This procedure, working with another surgeon and another specialist, the patient will go in, the teeth are removed, implants are placed at the same day, same appointment, and then a temporary denture is made that's permanently affixed to the implants, and all of this heals for a minimum of 6 months, and then once everything's healed and we're sure that the process is going as it should, then we come back and make a more permanent, longer lasting denture. But this is done in 1 day.
Then they have a permanent smile that they never have to worry about taking dentures in or out or any of those things.
That's right.
Wow, that's really a revolutionary treatment. Stay with us. We'll be right back with Dr. Edwin E.
With Dr. Yee, you always get his personal attention all the time. When you walk in the door, you have Edwin's wife greet you by first name. It's almost like you're an extension of their family. You feel very comfortable, you feel very at home, and it kind of puts you at ease. I would rate Dr. Yee as exceptional. When we came to Pensacola 10 years ago, we didn't know where to go. An associate referred us to Dr. Yee, and we've been here ever since, and glad we're here. My son comes here. Our whole family are regular patients for Dr. Yee, and he's a detailed guy. He does everything right pretty much the first time. You don't have to come back for repeat visits to do the same work you did the last time. That kind of professionalism is really appreciated.
And welcome back. Dr. Yee, we left just before the break talking about implantology and kind of a full denture and kind of a partial and then the individual teeth. Now you have something now called the small diameter implants, and I think you brought a model to show us. What is a small diameter implant?
When a patient has been wearing a denture for a long time, and it's real typical to see resorption of the bone that occurs from wearing the denture, simply because there are no teeth in place. And so that bone,
when you say reabsorption, what does that mean? Does the bone drop down?
Exactly.
Okay.
Because the only thing that helps preserve the integrity of the bone so that it doesn't shrink and get smaller are teeth or implants.
Okay.
So in someone that's been wearing a denture for a long time, and it may fit, it may not fit, it may have a loose, fit, we can use small diameter implants that are half the size of a traditional implant that are really made for people that have small, skinny ridges that support their denture. We can place these implants in a day and then put attachments inside the denture, and then these attachments in the denture snap in on top of the small diameter implants, and then it holds it in place like this.
Oh, wow.
So
So it's not permanent. These actually come out?
the implants don't come out. They're permanently in place, and their function is to secure the denture so that it doesn't
so
move
that it
around.
doesn't shift around.
Correct.
Okay.
And also it will help preserve the bone that is there from further resorption. So if you're having trouble with denture because of a poor fit and it's affecting your quality of life and how you eat and how you smile and, you know, just the simple pleasures of life, this can be a big help
Oh,
in improving
absolutely.
that.
Absolutely. So if you've had dentures for a couple of years or, you know, even longer, and you notice that the denture itself is not sitting where it used to sit and it's moving around, then you might be a candidate for the small implant or the small diameter implants that Dr. Yee's talking about. Pick up the phone and call him at 479-3355 because I think that's pretty outstanding. That's a great resolution to folks out there who've had, you know, just the standard dentures out there. I would suspect that a lot of your patients come in who've had dentures for a long time.
You know, I had a patient come in last year, and she is 98 years old.
Oh, wow.
And she had been to several dentists, and she was not able to keep her lower denture in place because she'd been wearing a denture for so long and had so much resorption of her lower jaw that she couldn't keep the denture in place. And we were able to successfully get 4 of these small diameter implants into her jaw, and now she's able to keep the denture in place. And she told me the last time she's in that she's eating better and she's been able to enjoy her food, and I think it's just made a huge difference in the quality of her life at 98 years old.
And you know, you mentioned that being able to eat, that's huge when you get older, and that even involves your family members. Because if you're taking care of a parent and they cannot eat alone or they're having a hard time, they may stop eating. They may just go to liquids, and that's not healthy. So that would be, like if your mom or your dad have had dentures, you know, you might consider bringing them in to see Dr. Yee because, you know, I'm guessing you may or may not be a candidate, and you would certainly let them know.
Absolutely. Not everybody's a candidate for that, but we would review your medical history. We would talk with your physician to be sure that you are a candidate, that we can safely do this procedure for you, because it is an in-office chairside procedure, so you don't have to go to the hospital to get something like this done.
Wow.
And your comment about nutrition for our elderly patients, that is so key.
Right.
Because as you get older in life, sometimes patients will neglect their teeth because they get older, they think they're not as important. But if you're in an assisted living facility or an elder care facility, you know, you're going to be mingling with the patients there, you're going to meet new friends, and you know, you want to be able to smile
Of course,
and laugh
right?
and enjoy life. And then the nutrition part is important as well, because if you can't eat properly,
It affects everything.
It affects everything,
Right.
and you don't get proper nourishment. And if you're not properly nourished, you might have more chances to develop an illness or a complication. And you know, studies have shown that patients that aren't eating properly, and if they're hospitalized, you know, that it can lead to a longer hospital stay because they don't recover as well as someone that's getting proper nutrition.
Which kind of brings us back, Dr. Yee, to that overall concept that you have in your practice, that a healthy mouth, a great dental care regime, and ongoing comprehensive dental care is equivalent to overall health of the body. And you know, that's a big deal for you because you're athletic, I'm athletic, and I came to you, and this is so important to me, folks. I came to Dr. Yee, I'd had an incident where I was on a water slide, and my lower jaw slammed into my upper jaw, and I was convinced that I had cracked a tooth. And I came to you, and I had this neck pain that was terrible. And you examined my teeth. I mean, I think I made you do it. I probably came in 2 or 3 times because I was that stubborn patient who knew that I had a cracked tooth. And Dr. Yee kept telling me, Malia, your tooth is not cracked. And let me tell you, folks, what I really appreciate about Dr. Yee is that he took the time to be concerned about me. And you mentioned to me the fact that I might just have tension in my neck from that incident. that really was not involving my tooth itself. And you referred me to Shelley Bagley, who is a massage therapist of all things, and she's the reason I sleep at night. And do you know, I've never had any of those mouth issues again, and since you referred me out to her. A big part of your practice is working with other doctors, with your patients, to help them achieve overall health.
Well, that's really wonderful that Shelley was able to help you. You know, when someone comes to me, and we're the physicians of the mouth, but, you know, we also look beyond that. And if I see an area that is not my expertise, and I can make a recommendation to a patient to go see a specialist for gum problems, or an oral surgeon, you know, that needs help with, you know, dental extractions, or even if they don't have a physician, I refer to physicians. I also work with a mental health counselor. You know, sometimes patients come in, they talk about different issues and concerns.
Sure.
And I have a lot of patients in the practice that are in different professions, and I try to make a referral for these patients, depending on what their need is, to these other healthcare professionals. And we use a massage therapist. I've recommended people to go see a personal trainer. I've recommended people to go see a mental health counselor or a physician. So.
And you also mentioned sleep apnea. That's probably something that you see a lot of in your practice, folks who aren't sleeping well and they think maybe it's bruxism or they're grinding their teeth.
Sleep apnea is a new area for dentistry. People that snore at night, or they have episodes where they're sleeping and they actually stop breathing, and that's called apnea. There have been definite links between snoring, sleep apnea, and heart disease and stroke. And so in dentistry, we have found that by fabricating special retainers or trays that fit into the mouth and reposition the lower jaw to help open the airway, that we've been able to help people overcome these issues and live a better, more comfortable life and reduce their risk for those heart disease and stroke issues.
Wow.
Now, there's no doubt that everybody's heard of the CPAP machine. That is the gold standard for treating these type of problems. But not everybody is willing to wear a CPAP machine. So it's those patients that don't or can't wear the machine that we find that these
That can be helped, right.
that these oral appliances can help them. We see people at all different levels of dental need. You can have you could be someone that's taken good care of your teeth like you have and have minimal needs, or you could be someone that unfortunately, for whatever reason, has neglected their situation. And so we're here to help people. And you don't need to feel embarrassed about wherever you are in the situation, because we're here to help. And when you come in, we'll find out from you what your needs are, and we'll try to help you at that level, and then help you make better decisions so that you can have a healthy, comfortable mouth, that a pretty smile, and that
functions normally.
And that functions normally.
Dr. Yee, thank you so much for joining us. Dr. Yee has been my personal dentist for a number of years, and I can assure you that no other dentist combines the art of dentistry with the science of dentistry like Dr. Edwin Yee. So if you want to restore function, create balance, or even create a more luminous smile, pick up the phone and call Dr. Yee at 850-479-3355 or go online to PensacolaDentistry.com. And on behalf of Dr. Yee and his dental staff, I'm Malia Allen, and thanks for joining us.